Sorry.
Hello everyone. Gosh, we've got quite a few people joining us already. Thank you so much. Timo, how are you?
Fine. Nice to be here again. Hello all. Hello, Andrea.
Yeah, good old Andrea. So yes, it's too early, Andrea, for Prosecco, or is it? So today we are going to be talking about how to check the health of your dog or cat at home. And you can employ these principles for any species of pet or horse or anything. So we're going to be demonstrating on a dog, but you can apply it to anything. Now, we've already got some really good questions in the chat. So what we're going to do, everyone in the chat, if that's okay, is we're going to come back. We're going to cover some of the stuff we want to do about how to check your pets. And then we're going to come back to the questions. So please don't think we're ignoring you, okay? Give us a thumbs up if that's okay. It's lovely to see some really familiar faces here as well.
Thank you very much. Very nice of you.
We've got some great faces here. So, Timo, let's get right into it so we can get through everyone's questions at the end. Why is it really important that as a pet parent, you learn how to do some basic checks yourself?
So, humans normally talk, and we talk a lot. And we are easy to tell what we need, what we feel, how we feel, what hurts. Dogs, especially dogs, but sometimes also cats, they are mostly soldiering through their problems. They just accept the problems as they are, and they just live with it. And we mostly don't recognize these problems till they are really advanced. So if, of course, it's good business for the veterinarians, but it would be actually very good for your pets and your purse if you would keep checking your dog and cat regularly by playing. It's not just it's not like you have to become a veterinarian and check everything, but there are so many things you can check just by touching and playing with your normal cuddling with your animal, and you find out many clues that might show you a direction where the health is going. And if you have them early on, you might get the good calls and also maybe stop a catastrophe from happening. And that's very important, especially for cats, because cats can have a lot of problems going slowly without you realizing them. And when they are there, it's already too late. So that's why we wanted to do this. Of course, we are not covering everything. We are not going very deep, but we would like to show you how to do very basic checkup regularly so you can see if there's something developing that shouldn't be part of the health.
Yeah, it's so important. So if as a multi-pet household, one of the things I've noticed is exactly that, because we're going to talk about the interactions of pets with each other and pets with us as well as we go through. But doing these regular checks, the earlier you notice something, the greater the chance of a less invasive and more successful outcome.
That's
and
correct.
It allows you time, doesn't it, to make the necessary changes. Whilst if we wait until the real symptoms develop, then obviously you can have to be doing more invasive, more intrusive things, more expensive, more stressful for you and your pet.
That's correct. Also, one more thing.
Yeah.
You also, when you find it earlier, your animal suffers less because the time that you are searching for symptoms to happen might be very long. And this might be a very long discomfort, very long dysfunction, very long period of time where the animal is not happy at all because it's just something is bugging all the time. And if you can find it out very early, then you save your cat and dog a lot of trouble, like a better life, higher quality of life, right?
Absolutely. And it really improves your relationship with your animals. So our animals are completely dependent on us. They're humans, really, and most of their aspects for their well-being. We make decisions about what they eat, what water they have, whether they have vaccinations, what chemicals they're exposed to. I mean, obviously, some of these are outside our control partially, but a lot of them are. And, you know, if we're take ourselves as a human, if we're handing our health over to someone, as is happening, a lot of people are doing at the moment, you want to know that you trust that person that's making decisions for you. So our animals are picking that up for us. So the better we educate ourselves, the more trust they're going to have in us, and they're going to feel secure in their home. So do you want me to show the video straight away, Timo, and then we discuss from there?
So I just tell, we made a video, not we, it's like we just discussed about the video and Catherine did one. And this is a general demonstration of how to check your dog, what to look at. Cats are similar, except the belly part is a bit different. So if you know your cat, but the rest is very similar. So just check it out.
Yeah. Okay. And basically, remember, guys, we are coming back to your questions then. So I'm going to show a little video, which is, I think, about 6 minutes long. And I'd like you all to have a look at that and just look carefully. And then we're going to be discussing certain points in it and asking your questions on it. So this is a video of my lovely dogs and me giving them a check over. So enjoy, everyone. My lovely model here, Lola, who's not looking very convinced by it all, and I'm going to show you how to do a physical check. So the first thing I'm going to start with is Lola's beautiful nose. Now, if you have a look at her nose, you can see it's really shiny, and when I touch it, it's beautifully wet. It's lovely and wet. This is her lovely sister, whose nose is equally wet. So what we're looking for in her nose, we're looking for, is it dry or scabby? Is it shiny? Touch it, see whether it's wet or dry. And you're looking for a nice, shiny, wet nose. Lola's very shy. So the next thing I'm going to check is her eyes. She's a bit shy and wondering what I'm doing. So if we look into her eyes, can you see how beautiful and shiny and sparkly they are? She can have a treat for that. I'll have to give Indy one too. These are organic chicken treats. So her eyes are beautifully sparkly, and what I'm doing, is I'm looking at her reactions. Are they nice? She says no problem there with eyesight with her following it. I'll give you one in a minute, Indy. So it's lovely sparkly eyes, looking at the reaction, nice blinking reflex when I go towards them. So the next thing we're going to do, Lola, is your beautiful ears. I like ears like this. Now, when I'm feeling the ears, there's no hotness or inflammation there. And then I'm going to look inside your ears, and if you can see there, they're lovely and clean, no redness, no inflammation. Oh, they smell lovely, Lola. They smell good enough to kiss. So now we're going to go down her spine. Now Lola's got a harness on because she's we're out on a walk, and I'm going down her spine, and I'm just checking. I'm using finger tight checkness. Obviously normally I do this without the harness on, to see if we've got any sensitivity there. And a little bit of reaction here actually, and she did jump over a big fence yesterday, so a little bit tender there. Rest of it looking pretty good all the way down, so that's nice. And what I'm doing is I'm running my hands over her, and I'm feeling for any lumps or bumps. Now Lola's got a very thick wolf-like coat, as you can see, because you're a little wolf, aren't you? So I'm feeling and making sure no lumps and bumps, and I'm also checking her fur. Now look how thick Lola's fur is. It's really thick. This is a bit orange here because she's been digging, and we've got orange sand here. And I'm feeling down and looking deep in her coat to check for any lumps and bumps or itchiness. Now in here we can see the natural powder here that I've got. This is my natural flea repelling powder, and I'll show you why. Because Lola here, can I just stand you up, darling? Lola here, I've got my trusted sister, has got a few sore bites here because she is very allergic to fleas, aren't you, Lola? So when she gets a flea bite or a tick bite and we're on sand, she gets soreness there. So that's why I use the natural flea biter. Now we're going to look down and look nicely onto her tummy. So what I'm doing, feeling down her tummy, making sure there's no sensitivity. No sensitivity, making sure there's no sore patches, that all her nipples are all okay and everything. Slight scratch around this nipple, so I've got to keep an eye on that. So obviously where she scratched herself. So that's lovely, no sensitivity there. You're so sweet. Now Lola, let's look at your Wolverine teeth. Look at her teeth. So I'm opening up, look at those lovely teeth. Opening up here to look for any plaque. Little bit of plaque on this back one, look. So we're going to discuss that. That needs a bit of attention, so she might need some more bones. Nice healthy pink gums. Nice reflex on her gums, lovely pink. And no, oh, your breath smells lovely, kissable. No smell on her thing. So a little bit of plaque. Now, one of the reasons Lola has a little bit of plaque is I don't give her as many bones as I should, because she's quite food aggressive in terms of she has to be separated from the others, so I can't give her bones with the others. And now she doesn't like this bit much. I'm just feeling in between her little paws and just making sure I feel, this is your tickly spot, isn't it? Feeling in between each paws, because it's really important that I check her claws and no dry or crack points between her paws. So she's got lovely claws, not too long. She's very tickly there, aren't you? And I've checked all there. So now we're going to have to get her up and just check your legs. Come on, Lola. She loves this sand. Come on, Lola. Lola, up here. Come here, I'll give them both a treat. So what I'm going to do now is finish off just by checking her legs. So what I'm going to do, Lola, is I'm just going to pick up her legs one at a time, and I'm going to flex them nicely, make sure there's no pain there, and I would do this on each side. You're a bit camera shy, aren't you? Just to check there's no sensitivity and no pain there. So that's pretty much it. So Lola, I would say, is doing very, very well, as is her beautiful sister Indy. The only thing I would say we need some attention for is this flea allergy, which I will discuss in the video what I'm addressing that with. And she's got to start with some plaque build-up, well, she has got plaque build-up on her back teeth. So that's something we'll be discussing in the video how to address. Well done. In the other video is weight. So Indy, if we walk up and down, I don't know if you can see on the video, but Indy's easier to show on the video really for weight. So when she's a bit shyer, Indy will stand up. When we stand up with Indy's weight, when I'm feeling my hand, I can feel her backbone nicely, and she's got a nice covering over her ribs, but I can easily feel the ribs. So very healthy weight. I mean, if I just Indy, walk up and down. She's such an active dog, but I don't know if you can see, you can sort of discernibly see her ribs. Lola's are more difficult because she's very thick fur. I'll just take Lola as well, Lois, and we'll just show them here. Lola, Indy. And Lola's a thicker fur, so she's much more difficult to try her way. Come here. Good girl. They love these organic chicken treats from Ricotta. So what I want you to do is with Lola, with a dog with a thicker fur, I've got to feel through the fur and feel, and I can easily feel every rib, but they're not jutting out, so she's not too skinny. So hopefully you can feel, I mean, there's no problem at all feeling your ribs, is there? And certainly no problem seeing your ribs. So obviously if you've got a dog that's got thick fur, it's going to be more difficult than say one like Indy, where you can quite clearly see the definition of the rib cage here and feel them very clearly. Another test is just when you turn their head to the side here, the other side, you'll see the definition of the ribs a bit more clearly. They'll do anything for these treats. Honestly, best treats ever. All right, thank you. Right, so that was a little lovely modelled by Lola and Indy, seeing their tickly spots and everything. Timo, I just highlighted this one from Rainbow about wishing her dog was so accepting. Now, before we go into your discussion of the points we've seen there with Lola, I just wanted to say to people, so Lola and Indy are rescue dogs, and when we first got them, they found it very difficult to be touched and found it. So one of the things that's really important with your dogs, your cats, your horses, your guinea pigs, whatever it is, your husbands, it's really important to get them used to being touched, get them used to having their teeth checked, getting used to their ears, get used to their paws. I have a lot of clients who can't cut their dog's claws and stuff, because this, getting them used to and enjoying that is so important for monitoring their health.
It's also when you touch them in all different ways before it's needed, before it's like sensitive, before it is necessary. It's a big advantage because you are touching them playfully. There is no need for panic for them because it's not going to hurt anyway. So once they feel like you can touch them without causing any trouble, it's far easier for them just to accept it, because at the beginning it's just funny because no other animal touches the animal that way. You just have to learn and get used to it.
Yeah, it's really good. So are there any points from that video that you wanted to bring out at all, or anything you wanted to discuss in more
No,
detail?
actually, I like it very much. The only thing that I couldn't, I'm not totally satisfied with, is it's impossible for you to show the reflex from the gum and
Yeah,
how fast it feels. You have to learn it yourself. But the necessary thing is when you push your finger into the gum and remove it, from white to pink should be very quick. If it's not, or if it's very pale and nothing happening, then you have an anemic dog for sure.
yeah. Now, Lola and Indy are approximately 4 years old. We don't know exactly how old they are. And I have also got Star, who I didn't put in the video because she's black and it's a bit more difficult to come out in the video. But Star is nearly 16, so a Labrador. And she's also got a really thick fur. And she has got quite a few fatty lumps, although I have been noticing they've really been just going in size since she's been on the clean slate. But checking for things like lumps and bumps is really important. Now, obviously,
Yeah.
as dogs and cats get older, Timo, they're more likely to have things like that.
That is correct. And you also have to, with cats at least, you have to check the gums more and the tooth more, because cats don't show it much, but they suffer a lot from their mouth. And yeah, gum problems and gum tumors are very well known with cats, and it can really get troublesome. And your cat might not eat because of that, and you might think she doesn't like the food anymore or what. And you can try everything, and your cat might not eat. But if you would have looked at it from time to time, you would already see a growth there, a change there, and that would solve the problem far earlier.
That's fantastic. So what I would say is what we're looking for is what's normal for your animal. So obviously, if you've got a young, healthy animal, you would be expecting to see sort of less lumps and bumps and tartar on the teeth, etc., than if you've got a very old animal. But
Yeah.
things like the breath, the smell of the ears, the smell of the breath, etc., can be very telling as well, can't they?
Yeah. For instance, if your dog's mouth smell like tuna fish, canned tuna fish all the time, you can be sure that he has major amount of parasites inside. Or you can also check for non-age related things, like you can check the clothes if there are some splinters in, some plants that don't belong there, or some fungus, something that looks off, some discoloration. And this is important thing because it has a direct impact on the quality of life.
Yeah, fantastic. So what we're going to do now is we're going to start. Just before we start going through all the questions, Timo, we wanted to talk to people about. So this is a basic test, just a very basic. Keep an eye on your pets of all species. So I do this with my guinea pigs just as much as I do it with my dogs, my horses, my cats. Some of my rescue cats are more tricky to do with because they don't like being touched so much. So that's something I'm gradually building up to. But this isn't the home first aid. So this is very much, it is also important for you to learn for your particular pet, if you're not close to a vet, how to take their temperature safely, isn't it, Timo?
That's correct. So we are living in far more advanced time, especially after COVID. The laser temperature devices are everywhere, the thermometers that you can use. So I would suggest you use the thermometer, the digital laser thermometer, which has a cold laser in it, directly in the ear, on the stem of the ear, so where it really contacts to the head. It takes 3 seconds. It makes beep. That's important, though. Make sure that this beep is already known by your cat and dog from beforehand. If not, it's going to look into the laser. This is not good. Not very dangerous, but it's not good at all. So try to make them first getting used to it before they have any fever. So when they have the fever, then they are not going to respond awkwardly to it. So the range normally for cats and dogs is very similar, sometimes even same, is 101 to 102.5 Fahrenheit. I don't know why you use that stuff. So Celsius is 38.3 to 39.5 Celsius degrees. So actually, I'm for Kelvin because true zero is 0 Kelvin. There is no temperature, like no heat. But again, yeah, I'm on Earth. So and you can check that with the laser. It just takes like 3 seconds, and then it will show you the true temperature of that. You can check both ears because sometimes they lay on one ear. It might be getting warmer than the other one, and so check that. But of course, you can still use the good old thermometer with a metal tip, and that you can use directly under the tail. But not every cat might like that, and some big dogs might cause trouble because they might sit on it with reflex, which happened to me with a huge Rottweiler. It's not a pretty thing, and you can cause real damage. So nothing happened in that sense, but it can happen.
Yeah. So there's lots of videos that you can do, lots of good online or in person first aid for your particular species of pet. And personally, I would really recommend that. So I did quite a long while ago a dog first aid, and I do run a horse first aid, or I used to. But it's really, really important that you know these basic details, because if your animal's slightly unwell, it's really useful if you're speaking to the vet to be able to tell them whether their temperature's normal. So getting them used to having their temperature taken when they're healthy will allow you to record a baseline temperature for that animal, and then you will then be able to
See the difference.
see the difference.
Yeah, it same goes actually for the heart rate.
Yeah.
And breathing, and that can change a lot between the health of the animal, between the breeds, between their sport, if they are working, and if they are a couch potato. That can all change. So it's important for you to know how to take those. You can get get a course for it, or you learn online how to do it. It's not really hard. We are not going to cover everything. It's impossible to do it today. But it's important to know more or less, even for your child. If I ask any woman now, what's the normal heart rate of your 7-year-old, they will not able to tell me. So how do you know if the heart is over hitting or too low? No, but they don't know.
Yeah. So the more we pay attention to this, the quicker we can take action. So what we're going to do now is we're going to go back to the start and answer some of these questions as much as we can on here. So we've got, right, okay. This is a good one for you to discuss. Vicky's dog has got a movable lump in the back of both of her hind legs.
Balls? No, it's just a joke. Yeah. So well, I don't know. I didn't touch your cat. I don't know how it looks, how the legs are. So maybe, you make a video yourself, touching it, showing it how it moves. But if it really moves a lot, and if they are not the testicles, there is nothing that should move there. So normally between the legs, you have the genitals and nothing else. So that can move.
In the back of both the hind legs. So this sounds like actually in the legs.
Yeah. So did the dog get an injection there? Did it get accident there? If it's movable, does it have a color? If you push it in, if you get your fingerprint in, or it's just moves, it's hard. It's a cyst. If it's a cyst, it's going to have some certain type of feeling to it. If it's a tumor, it will have a certain type of feeling to it. If it's a fat lump, it has a certain type of feeling to it. I advise you to bring it to the vet, and then he will tell you what it is, or she.
Yeah, so take it to the vet, get a diagnosis, and then now you've seen them, it's really great to monitor them. If it's a fatty lump, I have had really good success with, obviously diet is crucial, but also I am having really good success with the clean slate, the link to which is under all the videos on that as well, with removing toxins. Now, Linda's cats have been pulling their hair out. Any advice? So, what can cause? I mean, there's so many things that can cause this, but what would you start about with that, Timo?
Well, if there is a lot of suspense, and I'm not jokingly saying that, at home, with other cats and in between them, or another dog or something causing them to be really stressed and cannot express it, this is a possibility. Some mineral imbalance is a possibility. Some vitamin imbalance, especially the vitamin B series, is a possibility. And then gut imbalance, microbiome imbalance is a possibility. Hair having the cats touching some chemicals all the time on one spot is a possibility. If you use chemical warmers or something like that, or antiparasitic stuff that is touching that region and making that region uh, unhappy, it is a possibility. Some parasites is a possibility. Fungus is a possibility. As you can see, it's like possibility, 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 possibility. But if there are two cats doing it and not just one, then you can remove a lot of things from the list. So better go to the vet, check the hair and check the skin, check the region properly, and you will know.
Yeah. So it's definitely an issue. So it definitely needs looking into, Linda. Now this one's a little bit worrying. Simone, her kitten is passing blood that must be in her urine since her procedure. I assume that means since she was spayed a few weeks ago. Can I treat it naturally with, or do I need to give her antibiotics?
Well, antibiotics will not stop any blood. So if it's bleeding, you have to wait till the bleeding is over. What antibiotics can stop is that region getting bacteria in, or let the bacteria grow in the places it shouldn't grow. So, but if you want to get antibiotics, you have to go to the vet that made the procedure, show it that you have the problem, and the vet have to help you out with that, because this is their procedure. You didn't do it yourself. So, get the medical team that made the procedure handle this, because this is mostly out of your control.
Yeah, and also this is where it's really key, Simone, to make sure you're looking at how your kitten is behaving, because obviously a spaying is quite a major operation.
Yeah.
And so you need to check, are they eating? Are they playful? Are they acting normally? Are there any other concerns? If there are any concerns, get her to the vet straight away, because any internal infection could be very, very serious.
Yeah, and it go to the kidneys directly. So this is a dangerous situation. So get go there where you had the procedure. They have to help you out with this, because this is normal.
Yeah, it's not normal.
Yeah, it's not normal.
Now, Beth's cat, I've spoken to vet and we've spoken personally. Is there, her cat has got stage 3 kidney disease? Is
Yeah.
there, what sort of checks could she do to see whether it's,
If it's getting better or worse.
yeah,
So I think you cannot really see if it's getting worse or not just by touching it anymore. This is already a different stage. What you can do, of course, is to see if your cat's behaving better and moves easier and shows more vulnerability, because cats get more protective and more how do you say it, private, discreet when they have more problems. So that you can check, but it's impossible for you with your hands to check, of course. And I would never ever push my fingers into the kidneys with a ill cat that I know has kidney disease. So I would never ever do that.
yeah. So,
Yeah.
and Beth, I know, is already doing an awful lot to support her cat and has made some amazing sort of changes. So well done, Beth. We wish you well on that. Linda, I've got a query for this. I don't know if it's a question or not, but you said your bloods came back normal, but they noticed a slight marker with her kidneys.
All right. So I always tell that the blood is highly regulated. So the blood is a liquid that the body does everything to keep it in a certain standard. And if something is not really really off, you will not see it in the blood. For instance, if the thyroid functions more than 10%, you will not see it in the blood, but you cannot see it's 90% off. It just shows, okay, it's normal. Your cat might be totally empty of B12 in all her muscles, but has slightly a bit of in the blood, and it will show totally normal, although there is no B12 left in the blood. Or if the food has high enough calcium, the blood will show maximum saturation of the calcium, but the bones might be empty of calcium, and you cannot know that because the blood is not a good medium to show everything and everything that is all around the body. Of course, there are some things that are the quality of the blood you can check, like the blood count, typical cells, that shows something. But if you check the blood with many details, it's regulated. It's not going to show the reality, that moment, that now. You have to check with the kidney markers. And that's important because you might have to change the diet immediately. And depends on the markers. I didn't see the test, so I cannot say anything concrete. But you have to know that. If you see the markers there, act now. Because from here, it's only
Yeah.
downhill. So you have to act now.
On a personal experience, I do get very frustrated with most vets because when you have vets, quite often vets will say, oh, they're fine. And then you look at them yourself and you can see that there's things that are pushing limits or slightly out. So it's very important to ask questions and get them explained properly. And as Timo said, if there's anything that's showing something, investigate it straight away, because this earlier action can just save so much heartache later on.
And one more thing about it, when we are about the vets. So vets are normal humans. Some of them are good, some of them are bad. Some of them have good days, some of them have bad days. I can tell you something. I saw a dog from 50 meters, a huge Doberman, that was walking totally different in the front and the back. And it was so obvious how crooked it was because it was such in a pain, right? So we brought this, because I was on holidays, we brought this dog to another vet. And he touched everywhere. He said, he's fine.
Mm.
I said, okay, yeah, here's your money. See you, bye, never see you again. It's because it's obvious. But the problem was, we told him that he's walking funny. And the only thing he did is ask me to put it on the desk so he can just touch.
Mm.
But if you tell someone the walking is funky, the first thing you would check is the walking, isn't it? But no, he didn't, because he had a bad day or he's not interested in it. I have no idea what it was. But if the vet is that kind of vet, just take another one. It's I'm sure where you are, you can find other ones.
And don't be afraid to ask questions as well. It's really important
because
our vets are under a lot of pressure because they're on really tight time scales and they've got huge overheads and they've got personal lives like everyone else. So really show an interest in it. If you're not understanding or you're not sure, just ask. It's so important. There's no such thing as a silly question. Okay. So next question by Susan. Her ridgeback is shedding its coat in the autumn instead of the spring.
It can also do twice. It depends how the temperature differences is, because if it's always inside, if it's halfway inside, halfway outside, if it's always outside, there's there are many different temperature scenarios that can have a direct impact on it.
Yeah. So, and also when your dog is detoxing as well, that you might notice an extra shed. So, for example, if you've changed diet and things like that and improve that, that can also be a bit of a, it can be a bit of an issue. So not an issue, a good thing, getting the toxins out. So long as they're healthy and vibrant and the new coat's coming back well, that should be good, shouldn't it, Timo?
And you can always see that if the old coat that is shedding is dull, right? It's shedding because it's not needed there anymore. So if the shedding is made with really shiny coat, then you can think that, of course, something is wrong in the body and the body tries to react on it. But if it already looks dull, then you know that it's the right type of shedding, because that hair is not needed anymore.
Yeah. And Karen, we don't need to answer the question because Karen's all over dealt with it. But what I like about Karen is she noticed something was wrong with her cat. It couldn't jump up anymore. So she put some steps in to help it. And then she monitored it until it made a full recovery.
And that's great. So that's important. Yeah, that's very good.
Yeah. Well done, Karen. I'm not sure what this is in terms of about the DE, the diatomous earth. Yeah, I use it externally sometimes as part of quite often as part of my natural flea powder. But we don't tend to use it internally, do we, Timo?
Yeah.
Yeah. So, right, just going through the questions here. Lots of people loving Reiki, which is really, really good. Yes, pets respond so well to healing. It's just wonderful for them, and you can do that remotely as well. This question here, bentonite clay or clean slate, they're working completely differently.
Yeah. So, okay. Let's say the difference is between Vanish Ultra and scrubbing with ash. It's, you both get the job done. You get rid of the of the stain, but it's a total different job. So the bentonite is a super safe way of removing things, but it's very physical and it's very mechanical also. The clean state type of is more on the molecular level. It's like binding things by bentonite too, but again, they're not doing the same job. For instance, with bentonite, you can also get rid of old cholesterol lumps and things that are physically bound, and then get rid of. Clean slate will not do that, but clean slate can, on a molecular level, bind things and pull things out that the bentonite cannot do, because bentonite can work only on the intestinal tract. It will not go to the cells. It will not touch the joints. It will not pull metals and other toxins out from all the fat tissue. It cannot do that. Clean slate, on the other hand, acts like in the whole body, goes there, and it's very active. It's not like it's a programmed thing, but it's how it works. So that's why use both.
Yeah. And
sorry, sorry.
Well, one of the things I wanted to say, so we have a tendency as humans to say, this is a brilliant substance. So I use green clay. I use French green clay rather than bentonite clay. And I use it for loads of different things for myself and for my animals. And I love the clean slate. But what we tend to do, and then we've had the discussions before about colloidal silver and the words that I can't say that we've talked about earlier. But what we've got to do is we've got to understand what is the issue we're trying to address, and therefore how the substances work. So with all of these things, people to pass on and say this is brilliant, but it's really important to educate ourselves and understand how that particular substance works in the body or on the body if you're using it topically, because something can be really good but not for the right problem. So, it's really important that you know what problems you're trying to address with your animals, or what maintenance you're trying to do, or what preventive action. So I give my animals some stuff preventatively, like the clean slate, even if I'm not noticing a problem, because I know that there's toxins in all our environment, whether we like it or not.
At home too.
At home too, you cannot avoid them. So making sure that you've really given some thought to what are you trying to address, and then what are my options for doing that. And some substances are very safe for using long term, and some are not. So, I've already discussed, I love colloidal silver, but I only use it topically when there's a problem. I don't use it internally. So the more you research, the more confident you'll be able to do for the right product at the right time.
I want to add something. This is important for me because you are all pet owners. Pet is not the wrong word, maybe animal owners. So you all need tools, right? We all need tools. So you can have something like this, which is a knife, and try to do everything with that. Let's say bentonite clay, or you have a multi-tool. You have you also have a plier. You have a bottle opener. You have a separate knife that does separate jobs better. And it's important for you to understand that there is not either or for some things. You have to really know everything that is relevant in its quality and its use case. Right? So I never heard something, oh, my guitar is broken, let's use violin instead. So nobody uses violin for the guitar part in a song. So try to understand what tools you have in your hand, ask the right questions, and get expert in the differences between them, so you know exactly when to use what. It's not that black and white always.
Yeah. So Sally's asking this question thing. I was getting to you as quickly as I could, Sally. So basically, she's asked it in a slightly different way later on, saying what greens can or natural food will lower stomach acid in a dog. So I'm going to hand this one over to you to start with.
All right. So this is a bit of a problem. So, okay. The stomach's job is to break down protein, period. Like there is nothing else it should do. So if you put more fat than it's naturally on an animal, or carbohydrates and things that doesn't belong to that stomach, the stomach will increase the level of acid to digest that because it's not able to digest it. So when you have animals that normally eat plants, they have the digestive enzymes starting in their mouth and they can chew, and they have the shearing movement of their jaws, so that can make the things, greens and all the plants, smaller and mix with the enzyme, so they start to digest it in their mouth. Carnivores cannot do that, so they have to act like a knife and cut it off as quick as they can, swallow as quick as they can, and their stomach breaks it down. This is how they work. They're totally different systems. So if you add greens, fruits, things to the stomach, it will only slow down the digestion of the meat, not increase the digestion, because now the stomach acid has to get stronger to make it happen. Does it make sense?
Yes, but what we're saying is, so, looking at a balanced diet is really crucial, isn't
Yeah.
it?
Yeah.
In terms of how to balance your things. I mean, if her dog is screaming when emptying, that's pretty awful. And that could also be, if her dog's on a raw diet, that could also be too much bone in the diet as well.
That is correct. Or not enough fiber. But what I'm saying is too much stomach acid happens.
Yes,
If your
absolutely.
dog is eating something that slows down the stomach, so the stomach just tries to overcome this issue by producing more and more dense and dense and denser acid to just overcome the hurdle of digesting that thing that sits there and refuses to get smaller. So
Yeah.
that
So
that
we're
starts there.
recommending pureeing vegetables and making sure the diet that's on is balanced, because
That
again,
is correct. But for that, you can check the course we have. We
yeah,
discuss every detail from fiber, everything. And don't forget, your dog or your cat is not human. They have different needs for fibers. They have different microbacteria, microbiome. They have different length of their intestinal tract. The stomach acid is different. The distance between their mouth and their stomach is different. Their jaws are different.
yeah.
So the whole thing works differently. So what might work for you to calm your stomach down if you if you drink nice tea, is they have a total different need, right?
Yeah, absolutely. So Beth's recommend asking if we can recommend a thermometer, but I mean, I think you just got to research it, haven't you, and see what should she
That's
be
correct, but
for?
because of the COVID now, you have a lot of high quality thermometers in every different brand. There are, most of them are AA batteries. One thing small, like hand pick. You can go to any pharmacy and get one. They are all good. Digital
Yeah,
ones, they're all same. So it's, yeah.
great. I've asked Linda for some more information on this in terms of in what way she thinks her cat's breathing is changed, because she's obviously noticed something as an owner.
Okay, so uh, okay, so first of all, you have to find out, does your cat has an allergy that you are not aware of, or it doesn't show the signs of redness in the skin or something, but the breath can be changed by allergy. This is number one. Number two is you have to put your ear on the cat's back of, let's say, the ribs, and listen carefully. Do you hear any rough sound coming in and coming out from both sides? So you don't need you don't need a stethoscope. You can do it with your ears. Just put slightly, play with them. Put your hand and start to listen. Is there any rough sound, any obstruction kind of thing? Because sometimes one piece of plant, something somewhere, gets caught, and then the breathing totally changes because it creates inflammation, it creates irritation, and that can change. Another thing is you have to check metabolically. Is your cat fit, metabolically fit? And what was done before and how it changed. So try to figure out, then we can answer more.
Yeah, great. But it's very good you've noticed it. And I find it's really useful to actually keep a little diary note so that you can monitor changes, because sometimes it's really good to, then give your vet some information about when you're noticing it under particular circumstances, etc., if there's concern that persists. So Free the USA, love it. Older Minnie has lost sufficient amount of weight, is now struggling to walk around without weaving around very quickly.
All right. So I don't know how old. It might be drop in testosterone, and that can cause lots of massive of muscle loss. And once the muscle is gone, then they cannot, of course, keep their body in check. Check that. Check also the muscle stiffness and the strength on each leg, and see if this is the cause. And it can be also connected to thyroid. And there are ways to regain the strength and everything, but I don't know how old. You have to tell me that.
Yeah, and also taurine and things like that. So there's so
Yeah.
many things it could be, but
Yeah.
definitely, I'm assuming you've been to the vet and sort of get it checked out. We'd need a bit more information on that. So, any advice on indoor older cats' teeth hygiene?
Okay, so first of all, don't think about it as hygiene, because the mouth of the cat doesn't have to be clean in a sense like we think. It's important that the cat has always something that is slightly rough and touches the all sides of the tooth. But if a cat eats healthy diet without carbs or extremely low carbs, the tooth will not show any signs of plaque, right? So this is very important. So uh, wild cats don't have toothbrushes, they don't have dentists, and they keep them by chewing on something, but mostly what they eat doesn't cause plaque at all, because they are not eating carbs, and most of the bacteria that causes this problem are feeding on carbs. Yep. So number one, drop the carbs, check the course if you wish to, give almost no carbs at all, and forget about biscuits and all these treats that you give with carbs inside. Feed your cat carb free or 0.5% max of their daily intake, and then everything will be fine.
Yeah. Okay. Now we've got a question here from Shelley. Anything that causes reverse sneezing in dogs, and how can she help her dog? It's not something I know much about.
Oh yeah, reverse sneezing is mostly correlated with some type of some injections might cause it, or sometimes some vaccinations might cause it. So was your dog vaccinated lately? And if it's between within the first last 3 months, then it might cause it. It mostly slowly goes away, but it's actually a toxic reaction to the vaccine. And other than that, there are not too many reasons for that.
Yeah. Joyce is pretty upset with your advice about letting them fight it out.
No, no,
Joyce, also, you need to understand, Joyce, that we are going on a little sentence that you've put in the thing. So the more information people give us, the better. But if you're just giving us one sentence, then that's what we can answer on. So, we don't know what your setup is, what precautions you've taken on everything. So if you're asking a question, it's really important you give us as much information as possible.
yeah, but I don't want them to duke it out, especially when one is extremely young, and the other one is just bitter and just wants to level up in hierarchy and just use the small one as a stepping stone. That's not productive at all, and that's not good. What the need is, though, that the other cats step up and show the bad guy, hey, we cannot do it here, or you leave them all enough room so the small one knows when it can just back off and to protect itself. But when it's big enough, everything will be fine. So it's then they can duke it out. But right now, it's a stepping stone. You don't do that. It's humiliating. Yeah.
Yeah. Well done, DH, is for being so concerned about your nature's dog and giving them some helpful things to look at. So that's really wonderful that you're doing that. Thank you. Karen started to transition her cats from applause onto raw chicken. And the cats are sitting in the road waiting. That's fantastic. Now,
They know what's good. That's good. That also shows that the microbiome started to change, because they started to enjoy the raw and unaltered nature of their food. That's a very good sign.
yeah, brilliant. And the cat course has got lots of good advice in terms of what types of meat, how much liver, how much heart, how much thigh, how much thing.
How
Also,
much to cook?
yeah, exactly. So
How
that
to
would
store?
really help you, because I do see a lot of people, and I'm not saying this applies to Karen at all, by the way, because again, we're just going on a sentence, but I do see a lot of people that say they just give their cats chicken breast every day. Now, of course, that's better than the commercial things, but also
It's deficient in
not
many things.
balanced. It's
Yeah.
going to be deficient. So over time, that will give an issue. So it's a bit like looking at, we talked about the supplements or the clean slate versus the bentonite, etc. It's like you can have something that's really good, but equally you've got to have balance in the animal's life. And Michelle, absolutely, it will assist with environmental allergies, massively so. We've answered Sally's questions. Bob's saying, I hope I'm wearing my wellies. I was earlier, Bob, but I hope you're not being kinky there. Um,
Who's going to be kinky with valleys?
well, Bob likes my wellies. It's an Australian British joke. Yes, we shouldn't.
All right.
Tammy was saying that her dog has been diagnosed with pineal Cushing's disease.
All right.
I
Yeah,
think she's
sorry.
asking for any advice on that, any natural advice that she could do for that.
Well, yeah, just drop the carbs to zero as much as you can, and either get the course or just visit some place where you can find out how to feed raw as much as possible, and with a maximum 3% of carbs in form of fibers, and then get the vitamins properly. And I think the pineal gland is extremely sensitive to heavy metals.
I was just about to say that. Yeah.
Yeah, so yeah, zeolites to get rid of the heavy metals. It's a good starting point. You can also increase maybe high quality, and that's the hard part. um, Algae like chlorella. Spirulina is not that good for that, and increase the amount of capturing all the heavy metals and everything in the intestinal tract.
You might,
Yeah.
Tammy, you might be interested. Now, I see this a lot in various different species of animals, and in horses, there's been a lot of work done about how the environmental contamination can be a huge contributor towards this. So you might want to go and look at the interview I did last week with Clayton Thomas from Roots on the pineal gland, which might help. And have a careful look about any cleaners or anything you're using in the house as well. Not that these we're saying these have caused it, but we want to just really stop any toxicity getting in as much as possible. So Stu would like, he's got two lovely rare boys. Now 11 isn't old at all for cats, don't worry, but you're very right to look at any additional support that they might need.
Yeah, fish. So small fish. The biggest one should be a sardine and an anchovy. Not in the can, not oiled, not in the water. Buy it frozen, prepare it yourself, boil water, throw it in for 5 minutes, sorry, and get it out. And that's it. The small fish is a joint and mobility supplement in one perfect box. That would help.
Brilliant, and great that you're sort of looking at that. And again, healthy diet. So we've got one with Cushing's disease here, Timo.
Yeah, again, if you have Cushing's, the first thing you have to do is just drop the carbs. That's one thing. And don't increase the fat too much. Neither dogs nor cats are just made to eat too big amount of fat. So do the course or find in internet how to feed naturally, as raw as possible, with as low as carbs as possible. Dogs still need 3% of fiber. Cats need almost zero. So, yeah.
There's some really good ones out there. Dr. Peter Tobias has got some really good information on his site as well. So that's a wonderful resource for you all.
Yep.
Robin, probiotics. If you look back in our playlist, you will see we did a whole show on probiotics. So I think that it's really good that you're going to do that, that you're going to listen to that, and that'll answer all your questions you need to know about probiotics.
And
so,
if it's not answered, just come next week and ask again.
Yeah.
So then we will answer that.
Candles and air freshener wall plugs, absolutely lethal for cats and dogs. So really, really toxic, and for humans. So remember, our pets are an early warning sign for us, but they will take in the toxins far more potently than we will. Candles, if you've got 100% natural candle with no added chemicals to it or something, that's okay. But definitely not the fresh air fresheners and those awful plug-in ones and everything.
And that's actually, there's an oxymoron. They are not freshening the air at all. They're just polluting it more than it was before.
Very good point. And I love the fact there's loads of people in the course, and Beth is saying this in the course, and I love the way you're not in the course, in the chat, about how you're supporting each other. It's absolutely fine when your animals are taking a while to transition over to healthy food. As I've said, my dogs have been super easy. My cats, a couple of my cats were so tricky, you wouldn't believe it. And sometimes, even with the liver, I still sometimes have to mix that with a bit of something else to get them to eat it. So all we're trying to do here is be gentle on ourselves, do the best we can, move forward slowly, and you're all doing really, really well by trying it, experimenting, and sharing your tips with other people. So that really helps. Thank you. And we've got a few Reiki healers in the chat here as well. And obviously you can do distance Reiki. So if any of you Reiki healers offer distance training courses, feel free to tell other members in the chat, because that's a really wonderful thing for us all to empower ourselves. So I think we've answered all the questions, and we're right on the hour. So once again, really good participation with everyone. Really good of sharing of information in the chat as well. Is there anything else you want to finish with, Timo?
Yeah, many things, but not on this video.
Yes.
All right. Thank you all for coming. Andrea, thank you for the help. And check your dogs and cats regularly, or horses, and give them always a good pet, and find out where they are sensitive, where they are not, and go to the vet early, so that the bills are smaller and the damage is smaller, both.
Thank you so much for your participation, everyone. Let us know how you get on. Send us some good videos of you checking them, and we will be back next week. I've got to speak to Timo about next week, so we'll let you know, because it's actually my birthday next week. But if we will have a chat about that, and hopefully we will be back same time next week, and we will let you know in the upcoming videos what it's going to be about.
Yes.
Thank you. Bye, everyone. Bye-bye.